Welcome, everyone. My name is Crispina Ojeda Simmons. I'm a project manager with the DFSS Homeless Services Division. Thank you for joining me for an overview of the scope of services. What is the scope of services? This document is your contract with DFSS. Most agencies will have one scope per program. There are some exceptions. Please work with your program manager if you are unsure. In completing this document, please make sure that it reflects the proposed program in your RFP response. The program requirements listed in the scope of services are consistent with the requirements provided in the DFSS RFP. To begin the process, you will download the scope for your program model from the DFSS website. The link is provided on this slide. On this form, you will complete the information that we will be walking through in this overview. After the document is signed, the completed scope of services needs to be submitted to your program manager. They will reach out to you with questions or requested edits. Section A asks for your agency information, including your agency name, program name, ward name, the program name as listed in HMIS, and the HMIS number. The only exception on the HMIS information is for the B shelters, which do not use HMIS. On this slide, there's a link provided to find your ward that will help you to either find or confirm your ward number. Your administrative points of contact and their contact information needs to be filled in. This includes for your executive director, program director, fiscal contact, reporting contact. DFSS will use the contact information provided on the scope for key communications to your agency throughout the course of your contract. Should your administrative contacts change after the contract is executed, we ask that you please inform DFSS within 5 business days of the staff transition. The budget allocation information requested on this form is provided to you in the award letter. This includes the PO number, the funding source, and the dollar amount. For the program operations information requested, if you have more than one program site, please make sure that you enter all the information requested in the same order throughout the scope. This includes the program name, site information, hours of operation, subpopulation, the number of clients and households to be served. This form provides a site number for each item of information requested. If your agency has more than 3 program sites, please let your program manager know so that we can send you a form to complete with the correct number of sites that you will be operating. For the hours of operation, you can either check the box for 24 hours, 7 days, or provide the hours that each of your program sites will be open for each day of the week. For subpopulation, check all that apply. For the number of clients and households to be served, begin by providing your carryover clients from December for each site. Carryover clients are people you are serving in 2025 who will still be receiving services on January 1st or after. Then, add your projected numbers for clients and households to be served for each quarter of FY26. If you serve single adults, the number of clients served and households served should be the same. Once all your numbers have been entered, please add the total for each line. You will also need to provide information on the number of staff speaking another language. Please note that any changes to the information provided in the scope need to be communicated in writing to your program manager within 5 business days. For administrative contact changes, agencies must submit a letter addressed to the DFSS Commissioner on their agency letterhead. This letter can be sent via email to your DFSS program manager. For each site, please list languages spoken by staff other than English. Then add the number of staff that speak each language by shift. In the example provided on this slide, this agency has two sites where additional languages are spoken. One site has staff that speak Spanish, and the other site staff that speak Creole. In addition to the language, the agency has also indicated the number of staff that speak each language for each shift. The following three slides are instructions applicable to shelter programs. If your agency is running a shelter program, you will be asked to indicate if you will be using DFSS funding to purchase meals. If so, please calculate the number of meals that will be provided by each site. You will take the average attendance for the site, multiplying it by the number of meals per day, and multiplying it by the number of days in operation. In the example provided, this shelter site will be providing 32,850 meals for FY26. For each site, you will be indicating the number of shelter beds by household type and gender. You will also be indicating the room configuration for these beds. In the first example, this program has two congregate shelter sites where beds are provided in rooms shared by 20 or more people. All the shelter beds are listed in that selection box for each site. In the second example, this program has one site within which they provide beds in smaller rooms. After adding that there are 11 beds for women provided at the site total, they have indicated that two beds are in single rooms that share a bathroom, four beds are in rooms of two or doubles that share a bathroom, and five beds are in one room of five with a shared bathroom. The total number of beds entered into the chart equals 11, which is the total number of beds for the program site. Now we will be transitioning back to instructions applicable to all program models. The Homeless Services Division Scope of Services provides information on accessibility requirements for serving people with disabilities. These are not new requirements, but they are now being outlined in more detail in the scope of services. The Americans with Disabilities Act, or ADA, has two titles which are relevant to your contractual obligation as a delegate agency of the City of Chicago. The first is Title II, Local and State Governments, whereby services, programs, and activities funded by and carried out on behalf of the city must be accessible to people with disabilities. Title III, Public Accommodations, indicates that agencies providing lodging, such as hotel, motel, senior citizen centers, and homeless shelters, are required to ensure their facilities are accessible to people with disabilities. This includes both the physical space of the facility and also providing effective communication. In the scope of services, DFSS needs to know if your facility space, where programs and services will be provided, is physically accessible as indicated by ADA. All agencies are required to comply with all other aspects of ADA. Section 504 of the Rehabilitation Act of 1973, commonly referred to as Section 504, requires the DFSS and its delegate agencies ensure that unhoused people with disabilities can request and access homeless services. This includes locating and accessing emergency shelter, accessing services and programs, and the use of public and common spaces at program sites. Can the individual access the program or services being offered? If not, the agency must take proactive steps to ensure equal access for the person with disabilities. The only exceptions are if the accommodation would require an alteration to the program or impose an undue administrative burden. All agencies must adhere to the process outlined by DFSS for providing reasonable accommodations. A reasonable accommodation is a change, adaptation, or modification to rules, policies, practices, services, or a physical change to a space to provide equal opportunity and access to people with disabilities. In the scope of services, we are asking you to certify that you will adhere to the Section 504 policy. The Fair Housing Act, also referred to as FHA, protects people from discrimination based on protected classes, including disability, when renting or buying a home, getting a mortgage, seeking housing assistance, or engaging in other housing-related activities. FHA requires that all covered multifamily dwellings designed and constructed for first occupancy after March 13, 1991, be readily accessible to and usable by people with disabilities. Under FHA, people with disabilities may request reasonable accommodations. This includes requesting the use of an emotional support animal. In the scope, we are asking you to certify that your agency will adhere to the requirements of FHA. For more information, please consult the source documents provided in the scope of services. The link on this slide provides access to a training on delegate responsibilities in serving people with disabilities, conducted by the DFSS Homeless Services Division and the Mayor's Office for People with Disabilities. On this slide, we have the 3 items on serving people with disabilities that require a response in the scope of services. For ADA, DFSS needs to know if your facility where services will be provided is accessible to people with mobility issues that may use a wheelchair or other mobility device. This information will inform DFSS in managing citywide resources to ensure equal access for people with disabilities. For Section 504 and FHA, you need to certify that you will adhere to these requirements. Links have been provided with additional information on ADA, Section 504, and FHA next to the boxes requesting information or certification. Description of program and activities requests information on the program goals and performance measures. The description you provide of your program activities must be consistent with the information you provided in your RFP response. You also need to provide information on partner coordination and the program actions to be performed by your agency when at full capacity to meet program requirements and outcomes. Each program scope will have program model specific information provided in each of the following sections: program goals, target population, performance measures, program requirements, data reporting, and active contract meetings. All of this information will be consistent with the information provided in the RFP. Please refer questions on your program model to your program manager. In addition to requirements by program model, there are also requirements for all programs. This includes compliance with all of the following: the HEART Act, Chicago Continuum of Care services as defined, and the essential elements of program models, voucher quarterly expenditure targets, health and safety standards and regulations, and appropriate service for clients. For written requirements, agencies must have written policies for intake, grievance, conflict resolution, and other crises. This includes notifying your program manager in writing of any changes to the scope of services information provided. The family preservation policy, if relevant, system activities required or requested by DFSS, such as participating in the point-in-time count. For record keeping, delegate agencies interacting with children must comply with all applicable laws, including Illinois Abuse and Reporting Act. These agencies must complete a background check of staff prior to their interaction with children. All staff at these agencies must complete the mandatory status form. All required documents must be kept on file and accessible to DFSS and auditors upon request. Delegate agencies that handle food must have appropriate staff with the food handler certificate, which must be kept current. These certificates must be made available to DFSS and auditors upon request. Please consult the IDPH Food Handler FAQ at the link provided for more information on the food handler certification. All delegate agencies must comply with the requirements of ADA, Section 504, and FHA. Agencies must follow the process outlined by DFSS for providing reasonable accommodations to people with disabilities. This includes completing reasonable accommodation forms for requests received and submitting them to DFSS within 24 hours of completion. All delegate agencies must certify that the information provided in their scope of services is accurate, that they will fulfill the activities, and comply with all requirements. A wet signature in blue ink is required on the completed scope of services. Thank you so much for your time and attention.